swelling, and improve mobility. For someone with stiff knees in the morning, aching hands from arthritis, or persistent lower back pain, the relief can feel almost miraculous. The ability to move more freely, sleep better, and function normally again can dramatically improve quality of life. It's no wonder that NSAIDs are often the first line of treatment recommended for chronic musculoskeletal pain. However, this same mechanism that makes NSAIDs effective is also what makes them dangerous, especially when used frequently, at high doses, or over long periods of time. Over the past 2 decades, researchers have begun to uncover a troubling pattern. Large-scale studies involving hundreds of thousands of patients across multiple countries started to show that regular NSAID use was associated with an increased risk of serious cardiovascular events. These weren't small, insignificant changes. In one massive analysis, high-dose NSAID use was linked to about a 1/3 increase in the risk of major cardiovascular events, including heart attack and stroke. Some specific NSAIDs were even more concerning, raising the risk of heart attack by over 40%. These findings were not isolated or controversial. They were consistent across multiple studies and populations. And the risk wasn't limited to people with pre-existing heart disease. Even individuals with no known cardiovascular problems showed increased risk when using certain NSAIDs, particularly at higher doses. What shocked researchers most wasn't just the magnitude of the risk, but how quickly it appeared. For a long time, it was assumed that cardiovascular problems related to NSAIDs would only develop after years of heavy use. But newer data told a different story. In some cases, the increased risk of heart attack and stroke appeared within the first week of starting treatment. That means even short-term use, taking NSAIDs for just a few days for a flare-up of pain, could increase cardiovascular risk in susceptible individuals. This finding fundamentally changed how scientists and clinicians think about these medications. It suggested that the danger isn't just cumulative, it can be immediate. To understand why NSAIDs affect the heart, we need to look more closely at how they interact with the cardiovascular system. Prostaglandins don't just cause pain and inflammation. They also play essential roles in maintaining the health of blood vessels, regulating blood flow, and preventing abnormal clot formation. Some prostaglandins help blood vessels relax, keeping blood pressure under control. Others help balance clotting by preventing platelets from sticking together too easily. When NSAIDs block prostaglandin production, this delicate balance is disrupted. Blood vessels may become less able to dilate properly, leading to increased blood pressure. Platelets may become more prone to clumping, increasing the risk of clot formation. Together, these effects create a perfect storm for cardiovascular events. Another important factor is fluid retention. Many NSAIDs cause the body to retain sodium and water, which increases blood volume. This extra fluid places additional strain on the heart, particularly in older adults or those with underlying heart or kidney conditions. As blood volume increases, blood pressure often rises as well. Elevated blood pressure is one of the strongest risk factors for heart attack and stroke, and even small increases can have significant consequences over time. For someone already managing hypertension, heart failure, or reduced kidney function, NSAID-induced fluid retention can push the cardiovascular system past its limits. The risk is especially concerning for older adults. As we age, our cardiovascular system becomes more vulnerable. Blood vessels stiffen, the heart works harder to pump blood, and the body becomes less efficient at compensating for sudden changes in fluid balance and blood pressure. Older adults are also more likely to have multiple chronic conditions and to take several medications simultaneously, increasing the risk of harmful drug interactions. When NSAIDs are added to this mix, the potential for cardiovascular harm increases substantially. Yet ironically, older adults are also among the most frequent users of NSAIDs because they are more likely to suffer from chronic pain and inflammatory conditions. Certain NSAIDs appear to carry higher risks than others. Drugs like diclofenac and high-dose ibuprofen have consistently been associated with greater cardiovascular risk, while naproxen may have a slightly more favorable profile in some studies. However, no NSAID is completely risk-free. Even those considered relatively safer can increase cardiovascular risk when used at high doses or for extended periods. And because many NSAIDs are available without a prescription, people often take more than recommended or use them longer than advised, assuming that over-the-counter status means minimal risk. Another problem is that pain itself can mask danger. When someone experiences significant relief from NSAIDs, they may feel encouraged to continue using them regularly, even daily. Over time, this can lead to chronic exposure without regular medical supervision. Symptoms of cardiovascular stress, such as gradually rising blood pressure or subtle changes in heart function, often go unnoticed until a major event occurs. A heart attack or stroke can seem sudden and unexpected, when in reality, the underlying risk has been building quietly for weeks, months, or years. The good news is that pain management does not have to come at the cost of heart health. For many people, safer alternatives are available. Acetaminophen, while not an anti-inflammatory drug, can be effective for mild to moderate pain and does not carry the same cardiovascular risks as NSAIDs when used appropriately. Topical NSAIDs and other topical treatments can deliver pain relief directly to affected joints or muscles with much lower systemic absorption, reducing the impact on the heart and blood vessels. Physical therapy can improve strength, flexibility, and joint function, often reducing pain more effectively than medication in the long term. Weight management plays a critical role as well, particularly for joint pain, because excess body weight increases mechanical stress on joints and promotes systemic inflammation. Lifestyle interventions can be powerful pain relievers in their own right. Regular low-impact exercise, such as walking, swimming, or cycling, can reduce inflammation, improve circulation, and enhance overall cardiovascular health. Anti-inflammatory diets rich in fruits, vegetables, whole grains, healthy fats, and lean proteins can help reduce chronic inflammation and pain over time. Stress management techniques, including mindfulness and relaxation exercises, can also influence pain perception and reduce the need for medication. These approaches may not offer the immediate relief of a pill, but they address the root causes of pain rather than simply masking symptoms. None of this means that NSAIDs should never be used. For many people, they remain valuable medications when used judiciously and under proper medical guidance. The key is awareness and balance. Using the lowest effective dose for the shortest possible time can reduce risk. Discussing personal cardiovascular risk factors with a healthcare provider before using NSAIDs regularly is essential, especially for older adults or those with a history of heart disease, high blood pressure, diabetes, or kidney problems. Monitoring blood pressure and kidney function during prolonged use can also help detect problems early. The real danger lies in complacency, the assumption that because a drug is common, familiar, or sold without a prescription, it must be harmless. NSAIDs remind us that even widely used medications can have serious consequences when their risks are overlooked. Pain relief is important, but it should never come at the cost of long-term health or life itself. The goal should always be to relieve pain while protecting the heart, the brain, and the entire body. So the next time you reach for that familiar bottle, pause for a moment and ask yourself a question that few people ever ask. Is this quick relief worth the hidden risk? Because the most dangerous drugs aren't always the ones you've never heard of. They're often the ones you trust the most. And once you understand that, you'll never look at pain relief the same way again. Number 6 catches many people completely off guard. It's not a junk food, not a sedentary habit, not even something most people would think twice about. It's something millions of people have taken at least once in their lives without hesitation. Something doctors prescribe every single day. Certain antibiotics. Now, let's be clear from the beginning. Antibiotics save lives. They are one of the greatest medical discoveries in human history. Before antibiotics, even a small cut or a mild infection could become deadly. Pneumonia, urinary tract infections, simple dental abscesses, things we treat routinely today, once killed millions. Antibiotics transformed medicine. They made surgery safer. They extended life expectancy. They remain absolutely essential in modern healthcare. But here's the part that most people don't hear often enough. Not all antibiotics are equal. And when it comes to heart health, especially in older adults, some antibiotics carry risks that deserve far more attention than they receive. The biggest concern comes from a specific class of antibiotics known as fluoroquinolones. The name itself sounds technical and distant, but the medications in this class are incredibly common. You may recognize them instantly. Ciprofloxacin, levofloxacin, moxifloxacin. These drugs are prescribed for urinary tract infections, respiratory infections, sinus infections, skin infections, and more. They're often chosen because they're broad spectrum, meaning they target many different bacteria at once. Convenient, powerful, effective. For years, fluoroquinolones were seen as reliable workhorses of infection treatment. But over time, something unsettling began to emerge. Researchers started noticing patterns, signals that suggested these medications might be doing more than just killing bacteria. They appeared to be affecting connective tissue throughout the body: tendons, ligaments, blood vessels, and most concerning of all, the largest artery in the human body, the aorta. The aorta is the main highway of your circulatory system. It carries oxygen-rich blood from the heart to the rest of the body under enormous pressure, every second of every day. The walls of the aorta must remain strong and elastic to withstand that force. When the structure of the aorta weakens, the consequences can be catastrophic. One of the most serious conditions involving the aorta is an aortic aneurysm. This occurs when part of the aortic wall becomes weak and balloons outward, like a thin spot in a tire. Another is aortic dissection, where a tear develops in the inner layer of the artery, allowing blood to force its way between the layers of the vessel wall. Both conditions are medical emergencies. Both can be fatal, and both often occur without warning. In a major study involving over 7 million patients, one of the largest analyses of its kind, researchers found that fluoroquinolone use was associated with a 66% increased risk of aortic aneurysm and dissection. 66%. That's not a small statistical blip. That's a significant elevation in risk, especially when applied to a medication taken by millions of people every year. Even more concerning, the increased risk didn't disappear immediately after stopping the medication. The elevated risk persisted for up to 60 days after taking the drug. In other words, the effects on the body didn't end when the prescription bottle was empty. The biological impact lingered. For older adults, this matters even more. Aging naturally brings changes to blood vessels. The walls of arteries become less elastic over time. Blood pressure may rise. Atherosclerosis, the buildup of plaque, becomes more common. When you combine these age-related changes with a medication that may weaken connective tissue, the risk compounds. But the story doesn't stop with the aorta. Fluoroquinolones have also been shown to interfere with the electrical system of the heart. The heart isn't just a pump, it's an electrical organ. Every heartbeat is controlled by carefully timed electrical signals that travel through specialized pathways. When those signals are disrupted, the rhythm of the heart can become unstable. One of the known effects of fluoroquinolones is something called QT prolongation. The QT interval is a specific measurement on an electrocardiogram, representing the time it takes for the heart's ventricles to electrically reset between beats. When this interval becomes prolonged, the heart is more vulnerable to dangerous rhythm disturbances. QT prolongation increases the risk of life-threatening arrhythmias, including a particularly deadly one known as torsades de pointes. This arrhythmia can cause sudden cardiac arrest with little to no warning. And again, older adults are especially vulnerable. Age, existing heart disease, electrolyte imbalances, and other medications can all amplify this risk. What makes this issue particularly troubling is how quietly it can develop. Unlike side effects such as nausea or rash, electrical disturbances of the heart may not cause obvious symptoms until something goes terribly wrong. A person may feel fine until they don't. Over time, regulatory agencies around the world began to take notice. As evidence accumulated, warnings were issued, labels were updated, advisories were released. Today, health authorities recommend that fluoroquinolones be reserved for situations where safer alternatives are not available. In other words, they should no longer be the first choice for many common infections, especially in older adults. And here's the key point that many patients never hear. For many routine infections, older antibiotics work just as well. Penicillins, cephalosporins, nitrofurantoin. These medications often carry far fewer cardiovascular risks. They may not sound as powerful, but in the right situation, they are more than adequate and often safer. This doesn't mean fluoroquinolones should never be used. In some cases, they are necessary. Certain resistant infections may leave no better option, but necessity should be determined carefully, weighing risks and benefits, not assumed by default. Unfortunately, time pressure in clinical settings, habit, and a desire for broad coverage can lead to fluoroquinolones being prescribed when they may not be truly needed. This is not about blame. It's about awareness. Both patients and clinicians benefit when decisions are informed by the full picture. If you're prescribed one of these medications, especially if you're over 60, it is reasonable and responsible to ask questions. What infection is being treated? Are there alternative antibiotics that could work? What are the specific risks in your case? These questions are not confrontational. They are part of shared decision-making. Your health history matters. Conditions like high blood pressure, vascular disease, previous aneurysms, heart rhythm disorders, or even family history can all influence risk. So can other medications that affect the heart's electrical system. Context matters. This conversation isn't about fear. It's about respect for the power of medications. Antibiotics are not harmless just because they are common. Powerful tools require careful handling. What's especially striking is how many people who have experienced serious side effects say the same thing afterward. No one warned me. That doesn't mean the medication was wrong in every case. But it does highlight the importance of informed consent. Knowing the risks doesn't mean refusing treatment. It means choosing wisely. And this issue fits into a larger pattern we're beginning to understand more clearly. Many medications interact with aging physiology in ways that younger bodies tolerate more easily. What is safe at May 30th not be safe at 70? That doesn't make the medication bad. It makes individualized medicine essential. Heart health is not just about cholesterol numbers and blood pressure readings. It's influenced by inflammation, connective tissue integrity, electrical stability, and the medications we take every day. Sometimes the most unexpected factors carry the greatest impact. So when we talk about protecting the heart, we can't just focus on diet and exercise, important as they are. We also have to look at prescriptions, especially those that may quietly undermine cardiovascular stability over time. The goal is not to reject modern medicine. The goal is to use it wisely, to ask better questions, to recognize that common does not always mean benign, because sometimes the things we trust most are the things that deserve a second look. And this brings us to the bigger question, one that most people never stop to ask. If a widely prescribed, life-saving medication can quietly increase the risk of catastrophic heart events, what else might be hiding in plain sight? Because number 6 is only one item on the list, and the next one may surprise you even more. Number 7 on our list is a class of medications so common, so familiar, and so widely trusted that most people never question them. They're called proton pump inhibitors, or PPIs, and for millions of older adults, they've become a daily routine, taken as casually as a vitamin. You may recognize them instantly by brand names like Prilosec, Nexium, Prevacid, Protonix, or Asipex. They line pharmacy shelves. They're advertised as safe, effective, and even lifestyle-friendly. They promise relief from burning pain, discomfort, and sleepless nights caused by acid reflux and heartburn. And for short-term use, they often deliver exactly that. Proton pump inhibitors are designed to reduce the amount of acid produced by the stomach. They work by blocking the enzyme system responsible for acid secretion, essentially turning down the stomach's acid faucet. For people dealing with gastroesophageal reflux disease, stomach ulcers, or damage to the esophagus, this reduction in acid can allow irritated tissue to heal. In the short run, these medications can be extremely helpful. The problem is that what began as short-term therapy has quietly turned into long-term dependence for millions of people, especially older adults. Prescriptions that were meant to last weeks have stretched into years, in many cases, decades. And as time has gone on, researchers have begun to notice something deeply concerning. The heart-related consequences of long-term PPI use are becoming harder and harder to ignore. One of the largest studies ever conducted on this topic examined health data from nearly 3 million patients. When researchers compared people who regularly took proton pump inhibitors with those who did not, the results were unsettling. PPI users had a 16 to 21% higher risk of experiencing a heart attack. At first glance, that number may not sound dramatic. A 16% increase doesn't always raise alarm bells. But statistics don't exist in isolation. Context matters. When you consider how many people take these drugs every single day, the implications become enormous. PPIs are among the most commonly prescribed medications in the world. Even a modest increase in cardiovascular risk translates into hundreds of thousands of additional heart attacks over time. And that raises a critical question. Why would a medication designed to treat stomach acid have anything to do with the heart? To understand this, we need to look beyond symptoms and into biology. Proton pump inhibitors don't just affect acid production in the stomach. They also appear to interfere with the body's ability to produce nitric oxide, a molecule that plays a central role in cardiovascular health. Nitric oxide is produced in the lining of blood vessels, known as the endothelium. It acts as a signaling molecule, telling blood vessels when to relax and widen. This relaxation allows blood to flow smoothly and efficiently throughout the body. When nitric oxide levels are adequate, arteries remain flexible, blood pressure stays lower, platelets are less likely to clump together. Inflammation inside the arterial walls is reduced. In other words, nitric oxide is one of the body's natural protectors against heart disease. But studies suggest that proton pump inhibitors may disrupt this system. By interfering with certain enzymes involved in nitric oxide synthesis, PPIs may reduce the availability of this critical molecule. Over time, this reduction can have serious consequences. As nitric oxide levels drop, blood vessels begin to stiffen. The arteries lose their elasticity. Blood pressure starts to rise. The risk of clot formation increases. The delicate balance that protects the cardiovascular system begins to erode. And these changes don't happen overnight. They develop slowly, silently, and often without obvious symptoms, until something goes wrong. Another major study looked specifically at patients who already had coronary artery disease. These were individuals with known heart problems, people who were already vulnerable. Among these patients, long-term proton pump inhibitor use was associated with significantly higher rates of cardiovascular mortality. In other words, people with heart disease who took PPIs for extended periods were more likely to die from cardiovascular causes than those who did not. That finding alone has forced many researchers to reevaluate how these drugs are prescribed. For years, PPIs were considered relatively harmless, especially compared to older ulcer medications. They weren't associated with immediate, dramatic side effects. They didn't cause noticeable sedation or obvious organ damage in the short term. But long-term use tells a different story. Beyond heart attack risk, researchers have linked prolonged PPI use to a growing list of concerns: kidney disease, nutrient deficiencies, bone fractures, infections, and even cognitive changes. Each risk on its own might seem small, but together, they paint a picture that is far more troubling. This is why many experts now recommend reconsidering long-term PPI use, especially in older adults, and especially in those with existing heart conditions. That doesn't mean these medications are evil, or that no one should ever take them. It means they should be used thoughtfully, intentionally, and with a clear understanding of both benefits and risks. For many people, acid reflux is not caused by excessive acid, but by lifestyle factors that can often be addressed without medication. Excess body weight, particularly around the abdomen, increases pressure on the stomach and pushes acid upward into the esophagus. Even modest weight loss has been shown to dramatically reduce reflux symptoms. Eating habits also play a major role. Large meals stretch the stomach and increase acid exposure. Smaller, more frequent meals reduce that pressure and give the digestive system a chance to work more efficiently. Timing matters too. Eating late at night, especially within 3 hours of bedtime, makes reflux far more likely. When you lie down, gravity no longer helps keep stomach contents where they belong. Acid can easily flow upward, irritating the esophagus. Simply avoiding food close to bedtime can make a noticeable difference for many people. Then there's sleep position. Raising the head of the bed by a few inches allows gravity to work in your favor throughout the night. This simple adjustment has been shown to reduce nighttime reflux without medication. Trigger foods also vary from person to person. Spicy foods, chocolate, alcohol, caffeine, and fatty meals are common culprits, but not everyone reacts the same way. Identifying and reducing personal triggers can significantly improve symptoms. For individuals who still need medication, alternatives exist. H2 blockers, such as famotidine, reduce acid production through a different mechanism. While they are generally less potent than PPIs, they also appear to have a more favorable cardiovascular safety profile, particularly when used as needed rather than continuously. Again, Any medication decision should always be made in consultation with a healthcare professional. The goal is not fear, but awareness. Because what's most concerning about proton pump inhibitors isn't just the science. It's how quietly the risk accumulates. Many people started taking these drugs years ago and never stopped. Prescriptions were renewed automatically. Over-the-counter versions made access even easier. No one questioned whether continued use was necessary. And all the while, subtle changes were happening inside the blood vessels. Changes that couldn't be felt, couldn't be seen, and often weren't discovered until it was too late. This is a pattern we see again and again. A medication solves one problem, but over time, creates another, often more dangerous, one elsewhere in the body. And proton pump inhibitors are only number 7 on our list. Because as serious as these risks are, what comes next is even more alarming. The medications ahead don't just increase risk quietly over time. They interfere directly with the heart's electrical system, the blood's ability to clot, and the body's capacity to recover after damage has already begun. And by the time most people realize what's happening, the warning signs are already behind them. So if you think the risks stop here, if you believe this is as serious as it gets, stay with us. Because number 6 may be sitting in your medicine cabinet right now, and its impact on the heart is far more dangerous than most people ever imagined. Cardiac surgeons are not telling people to stop medications abruptly. They are urging informed conversations. Many medications once considered safe now carry well-documented heart risks, especially for older adults. Heart damage is often preventable, but prevention begins with awareness. After watching this, are you planning to talk with your doctor about your medications? Or does that conversation feel uncomfortable? Let us know in the comments. This discussion could save a life. Thank you for watching.